The news day continues here on One News Now. I'm Jess De Los Santos. Over 380 new COVID variant cases have been detected in the country. Out of this number, 170 new cases are of the UK or the B117 variant, and 192 are of the South African or B135 variant. One patient was found to have the Brazilian or P1 variant, while 19 have been infected with the P3 variant first found in the Philippines. Over 1,300 samples have recently underwent genome sequencing nationwide. With the continued spread of these more infectious variants, the Health Department continues to urge the public to strictly and consistently adhere to health protocols. Due to limited personnel, some private hospitals around the metro cannot comply with the government's directive to increase their COVID-19 bed capacity to 30%. In an interview with One News Now, Dr. Jose De Grano, president of the Private Hospitals Association of the Philippines, said a lot of frontline healthcare workers have contracted the virus and have become patients themselves. So even if hospitals want to increase their bed capacity to accommodate and admit more people, they don't have enough personnel to manage additional patients. De Grano added that the recent deployment of healthcare workers from Visayas and Mindanao won't help private hospitals, as these augmentation personnel are sent straight to government hospitals and facilities.
Private hospitals would like to really comply with that, with the increase from 20% to 30%. However, we are limited with the number of nurses that we can give them. So we are limited with that with the employees that we have, so that we cannot just increase the number of beds physically, because there will be no healthcare workers that will manage these COVID patients.
De Grano also clarified how come dozens of COVID patients are refused hospital admission daily, even though the DOH regularly reports that NCR hospitals are not yet at full capacity. He explained that hospitals typically refuse new patients upon reaching 80% capacity, since the remaining 20% non-occupied beds are reserved for patients already in the emergency room. In effect, some residents of NCR are forced to go to nearby provinces like Laguna just to get medical attention.
The private hospital is a fixed number of beds in the hospital. Even if it says there that 80% occupancy, the last 20% usually are already reserved more or less for patients who are waiting at the emergency room or are being still managed at the emergency room. So usually they will tell you that if you call the hospital, they'll tell you that it's already full, because there are still waiting patients at the emergency room.
All 300 hotels in Metro Manila under the Philippine Hotel Owners Association are now fully booked and can no longer be converted into quarantine facilities. In a press briefing, PHOA President Arthur Lopez said all their facilities are now serving as temporary lodging for returning OFWs. This comes after the Philippine College of Physicians urged the government to convert hotels into additional quarantine sites as more and more hospitals reach full capacity.
Now, to convert hotels to hospitals, I think that's gonna be very difficult. No? Kasi maraming kailangan ng hospital. Mas marami silang detalyang kailangan to support patients. Operating rooms, particularly, okay? So, I don't know. But, ang problema, wala tayong mabibigay na hotel. Kasi kung hindi, kawawa naman ang mga OFWs natin.
The world's economic hierarchy is making it more difficult for low-income countries to gain access to vaccines. The WHO tells world leaders what to do to combat this problem. Let's watch this.
Maria Angela, my first question to you is, this lack of access to medicines, treatments, to vaccines around the world, how is that impacting our fight against COVID-19?
I think this is a very good question because we are talking about something that's very actionable, which is equity in health care. Right? This is a no discussion. And this pandemic just made what was bad worse. And we are seeing huge inequities in access to health care in many, many countries, within countries and across the world. And we are seeing that problems that were chronic in some countries, like the oxygen provision to patients with pneumonia, for example, have become much more acute right now because of the issues with the number of cases increasing so much. We also see that we know more than we knew 1 year ago on clinical care, and we see that medication that are not under patent or anything, that are actually quite cheap, may not be available in some countries, and they make a difference when you have a severe case of COVID-19. So there's a lot that can be done because we always say that equity in healthcare, it's above all, it's not only preventable, but it's also actionable.
Mariangela, I wanted to ask you, if a country can afford to vaccinate their entire population, why should they not do that? What exactly is WHO and agencies like WHO, what are we asking these countries to do exactly?
It's not about getting to the moral high ground, but it's something that should touch every human heart because this year we have supply problems, 2021. We don't have enough vaccines to vaccinate everyone in the world. And what WHO and other partners, international partners, are advocating and pushing very hard is that to end the acute phase of this pandemic, we need to have access to vaccines in all countries, reaching healthcare workers, because without healthcare workers, you don't have healthcare. And this is extremely important. And also to prevent people from dying. We know now, we've known from some time that some people are at higher risk of dying if they acquire this new coronavirus. And we are talking about people over 65 and also people who have comorbidities, which means have associated diseases. So it's really, really important that countries think about this and individuals think about this as well. What is the best situation for the world? The best situation for the world right now is to prevent deaths among people who are at higher risk of dying and to protect health systems so that all countries can deal with this pandemic. Another issue that's very important to raise that when we are talking about equitable access to vaccines, we are not only talking about solidarity. Solidarity is good, but we are also talking about country self-interest because the more community transmission we have around the world, the more are the chances of the emerging variants that could one day create a problem to have effective vaccines. So it's extremely important at this stage that we ensure that all countries across the world have access to the vaccines that are safe and effective and that are in the market right now.
The DFA says it will raise the recent incident in the West Philippine Sea involving a Filipino TV crew to China if the reports are verified by Philippine authorities. Recall that last week, ABS-CBN's Chiara Zambrano reported that she and her crew were chased off by a Chinese missile fast attack craft in the West Philippine Sea. According to Zambrano, they were heading to Ayungin Shoal from Palawan when the Chinese Coast Guard radioed them to ask what they were doing in the area. This led them to return to Palawan, but still a Chinese vessel proceeded to chase their boat away. The Department of National Defense has already ordered an investigation into the incident, but the DFA said it will first wait for officials to verify such claims before acting on it. And it's official, the Philippines will host the third window of the 2021 FIBA Asia Cup qualifiers. The country will be hosting Groups A, B, and C. Gilas Pilipinas is under Group A along with Korea, Indonesia, and Thailand. The games will be held at the Clark City bubble from June 16 to 20. Samang Basketball ng Pilipinas President Al Panlilio says they are working closely with FIBA to ensure the safety of all athletes inside the bubble. He also assured delegates and fans that they have complied with all the safety requirements of Philippine authorities for the holding of sports events. And in some light news, Russians swapped their winter gear for shorts and bikinis and slid down the mountain slopes of Sochi. Over 700 Russian riders wearing bright and skimpy swimwear braved the 8-degree Celsius cold and defied COVID-19 restrictions for the Boogle Woogle Carnival in Rosa Couture Resort. Thousands of people gathered and cheered on the participants who navigated down the over 1,000-meter hill. The annual festival has attracted participants and revelers since 2016, but was canceled for the first time in 2020 when the pandemic started. And those are the top stories of the hour. Join us later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Jess De Los Santos. We are One News.